So I am a midwife, and specifically a certified nurse midwife. A certified nurse midwife is someone who got their RN and then went to get their master's in midwifery, which is an advanced practice nurse degree. Midwifery is a practice that's as old as humans are. You know, midwives have been around delivering babies since the first human was born. Midwife means with woman, and it's because they're there with women through it all. Midwifery is a practice that is grounded in holistic care of a person, especially through their pregnancy and postpartum. We are medical providers, we know medicine, but we're also going to talk to you about what's going on in your life and check in about home, and because we know that that influences your medical care. We are grounded in education. We're always trying to provide education and promote education, because your education's your empowerment and your experience. So if you hang out with me, we'll be doing a lot of that too. So in an appointment with the midwife, you will, have your blood pressure checked, check your urine, have your weight checked, because those are all grounding, important information that we need to make sure you and your baby are healthy. From there, we'll listen to baby, measure your belly, but along the way, we'll make sure you are up to date on all the things that you need to be healthy in your pregnancy, know what's coming up, talk about maybe childbirth education in the community you can go to, get you set up for prenatal lactation, help you connect the dots of your pregnancy to your postpartum experience and beyond. A big benefit of midwifery is the holistic model of care. So we know that your body is working in these rules of medicine, and your labs are changing, and we know that. But we also know that your lived experience shows up in your body and influences what care might need to look like for you. Midwifery includes that in the education and training process, so it comes a little naturally to figuring that out. Also, midwifery is rooted in education for the patient, for the family. So it is always a joy to be working with patients and teaching them about what part is presenting in their baby, and feeling the baby's head and learning what the numbers mean. It's not my job to just tell you, oh, you're measuring on track, but you're measuring 28, and here's actually this foot. Do you want to feel this foot? Does your baby want to help me listen to the heartbeat? The toddler that you have in the room. I think that we, in our practice, are just able to incorporate a little bit more of you and your family into your care. I absolutely love working with my doctors here at Dedicated to Women, and also at Kent General. It is so nice to know that I have people with extensive years of training and experience in the complications to back me up and help me figure out if I'm making the right plan for someone, or that we need to actually escalate that plan to somebody else. We are always working with our doctors and collaborating in care to make sure you and your baby are safe. This can look like, if your blood pressure is high, I know what to do about that, but let me just double check that my plan makes sense. Or if you're a high-risk patient and you're wanting some midwifery care, working alongside the doctor to make sure everything's going appropriately, while also giving you that education and that holistic care. It is also amazing to have Dr. Ward, MFM, maternal fetal medicine, who's a high-risk doctor, right down the hall. Because when someone is presented with something tricky, or something's coming up in ultrasound, I can just skedaddle down the hall and get a direct answer, or at least loop the patient into immediate care. It is such a privilege to have that here. We are always collaborating, and also collaborating with doctors in our community, because we know that pregnancy is not just one little thing, but a collection of all the different systems working. Sometimes my patients need to see a neurologist or a cardiologist or an endocrinologist, and our coordinators know the community so well and can get people in, get referrals going, and it is a gift to have such a network of providers in this community. So in terms of if you want to work with a midwife or you don't want to work with a midwife, it's totally your choice, especially here in the office. You can elect into midwifery care. Some people see me because they were looking to see a midwife, and some people see me just because I was the next open appointment. Either way is fine, and you can certainly elect to not see a midwife, because we have a lot of doctors here that you can see for sure. The only time I would say you can't really see a midwife is if you are so complicated or high risk that you really need those extensively trained, been in the business for a long time of taking care of people's eyes on you like a hawk. But otherwise, we're here for you, and here to help you have a healthy baby.